So the median nerve is usually presents with motor weakness and sensory loss, and the median nerve has entrapment within those muscles, which affect the wrist flexors and finger flexors, and patients will typically experience numbness and tingling.
Okay, first we are going to depress the shoulder girdle and supinate the forearm, and then we will abduct the shoulder to 110 degrees, and then externally rotate the shoulder. And then we're going to extend the wrist, and then extend the fingers and thumb, and then move the elbow from flexion into extension. And if she doesn't feel anything there, we will laterally flex the cervical spine away from that arm. So she's going to touch her ear to the other side.
To begin with this, we're going to do wrist neutral with fingers and thumb flexed, then wrist neutral with fingers and thumb extended, then wrist and fingers extended, thumb neutral, then wrist, fingers and thumb extended, then wrist, fingers and thumb extended and forearm supinated, and wrist, fingers and thumb extended, forearm supinated, and thumb stretched into extension.
So we go from the least stretched to the most stretched.
There are varying desensitization techniques for peripheral nerves. So a couple of the things, we just need various stimuli, and it's going to change from person to person what is irritating to them or what's not irritating. But what you're going to want to do is they are going to want to spend 1 to 3 minutes daily in these stimuli, and you're going to want to rotate through them so that they don't just get used to it, but we put these little items in there so that they can find them and they feel different sensations. But like for me, the beans don't irritate me. I don't have a problem with the rice, the macaroni, the oatmeal. But then once we get to the cotton and the sand's kind of gross to me, but cotton is fine. But we just move on and you kind of change it up so that they can continue progressing. Okay, so we are going to use TheraPutty to strengthen our grip strength, our wrist flexors, and our finger flexors. And we're going to do this for 30 seconds at a time for 3 times, but we're going to rest with a minute in between.
Okay, to strengthen our wrist flexors, we're going to grab anything that has a little weight with it and have our forearm stabilized and curl up with using only our wrist, and then slow and controlled on the way back down. And we would do this 3 sets of 12 with 1 minute rest in between those sets.